Hi, everyone, and good evening. I'm Vicki Petersen. I'm the Iowa EMS for Children Program Director. Welcome to the Heartland EMS for Children Coalition Symposium on Farm Safety and Farm and Ranch Safety. Sorry, golly. This is the 13th topic in our ongoing free pediatric education series and the 6th symposium where we've used Children's Minnesota's education and training system for continuing ed credit. Children's does require you to set up an account on their learning site to receive education credit. This gives a lot of benefits for you. It will provide your certificates much faster than we have been able to do in the past. And when you create an account, you do get access to all their continuing education that's on the site. So take a look at the catalog. You might find something else that you'd like to watch as well. Children's Minnesota also issues EMS credit. So EMS providers can now get their CEUs the same way as other registrants. That means a faster response time for you as well. EMS providers can still watch in a group too using one registration link. Just make sure that you email a roster or a list of attendees to your state EMSC manager by the end of the day tomorrow so that we can provide that credit. By the way, no need to put your name in the chat like webinars sometimes ask you to do. Zoom will keep a record of everybody's attendance who is registered and their viewing time. We won't take a special break during our presentation, but please do step out if you need one. And before we move into our presentation tonight, I want to tell you a little bit about the folks who bring you these symposiums. These symposiums are a product of your state EMSC program. EMSC stands for Emergency Medical Services for Children. It's the only federally funded program in the country dedicated to helping emergency care providers take the very best care of kids. Each state and territory in the US has some type of EMSC program that is funded in all or in part by a grant from the federal government. Our group's called the Heartland EMS for Children Coalition. We're a group of Midwestern EMS for Children program managers from Iowa, Kansas, Minnesota, Nebraska, North Dakota, and South Dakota, who have banded together to maximize our impact in our own states through pooling our ideas and our resources. The behind the scenes members that you don't see, but who are working really hard for you are Corolla Lauck from South Dakota, Kjelsey Polzin from Minnesota, Jessica Baker from Kansas, and Chettie Greer from North Dakota. Currently, Nebraska doesn't have an EMSC program manager, and we're waiting patiently to welcome a new member. These pediatric symposiums were born during the pandemic from a lot of discussions that we had about how best to bring you affordable continuing education under unusual circumstances. And since September 2020, we've offered 46 hours of free continuing ed, advanced practice providers, and more on topics like children with special healthcare needs, burns, human trafficking, pediatric respiratory illnesses, youth suicide, poisons, just to name a few. I also want to let you know that you are all in listen only mode. That means that your mics and your webcams have been automatically disabled. If you have technical problems, you need support, or you just have a comment, please use the chat box and we will respond as we're able to. If you have questions that you'd like to be asked during the Q&A session at the end of our symposium, please type them in the Q&A box and we'll get to as many of them as we have time for. Finally, all attendees must be present for at least 90 minutes and complete an evaluation to receive continuing ed credit. Once the symposium is done, you can access your Children's Minnesota account site, fill out the evaluation, and you'll get your credit very quickly. If you don't sign on to your Children's Minnesota account right away, you'll get an email about completing your evaluation. Your certificates can be found in your account after your evaluations are received. Please print them or save them for your records. Please remember that you must complete your evaluation within 30 days of the symposium to receive credit. After that, you'll no longer have the option for credit. As always, if you have any questions, please reach out to your state program manager and we'd be glad to help you. This is our contact information. Please reach out to your state's person, or for our friends in Nebraska and the Heartland EMSC email. This is the accreditation information. These are the disclaimers, and we have no disclosures. Okay, done with housekeeping. Now on to our presentation. Our presenters this evening are here to talk about the unique health risks to children involved in farming and ranching, including agricultural injuries and ATV accidents. Our presenters will also discuss injury reporting, research, state regulations, and what some states are trying to do to keep farm and ranch kids safe. Our first speaker is Angie Johnson. Angie is the North Dakota State University Farm and Ranch Safety Coordinator. She is co-author of the research article entitled Children and Youth Agricultural Injuries, a retrospective analysis of pediatric trauma admissions in North Dakota. Angie has been farming since middle school, and she and her family raise livestock while all working together on a farm in North Dakota. A little later, we'll hear from Dr. Dylan Goehner. Dr. Goehner is with the University of South Dakota Sanford School of Medicine, and he'll briefly talk to us about head trauma associated with ATV accidents in kids. Now I will turn things over to Angie Johnson. Welcome, Angie.
Thank you so much, Vicki, for the very warm and kind introduction. I'm going to go ahead and share my screen with everyone here. All right. Let me minimize. Well, again, I just can't, it is such an honor to be in front of this group. And I want to give a special shout out to Chettie Greer for even reaching out and having some awesome conversations together and inviting me to this symposium. I think it's, I'm quite honored and humbled to be in front of an amazing elite audiences of yourself, and to be able to share some of the work that we're doing here at North Dakota State, and hopefully throughout today's presentation, I hope I exuberate the passion that I have for our kids, and especially when it comes to working on a farm or a ranch, or being raised on a farm and a ranch. We unfortunately keep losing young kids to farm and ranch related incidents, and I'll kind of talk through that tonight. And I really do. I know your cameras are off and your mics are off, but definitely please feel free to use the chat. I want to hear from you and your experiences, and be able to answer any questions you may have, or if I don't know the answer, take the time to be able to get back to you with an answer to your questions. And so thanks all for being here tonight. Just want to give a quick non-discrimination statement that our programs here at North Dakota State do not discriminate. And so if you have any questions or comments or feedback on tonight's materials regarding the format that this has been provided in, please make sure to contact our Title IX coordinator with the contact information provided on the slide in front of you. With that, I want to go ahead and get started. I think it's really important that I want you all to get to know me a little bit, just because if my accent doesn't give it away, and the green and gold colors don't give it away, I am from North Dakota, and extremely proud to be from North Dakota most days. I know we definitely have our challenges, but I'm from a teeny tiny town of Galesburg, North Dakota, so about 50 miles northwest of Fargo. I work here at North Dakota State University. I've been with NDSU Extension since 2015, and so all of you on today's call, I hope within each of your states, not just North Dakota, but within each of your states, you have a land grant university system, and what that means is I will say it, you are blessed with an extension system. Everybody's looks a little bit different, but you all have some type of extension outreach or extension service within your state, which means you have individuals that serve your communities in the realm of agriculture, family community wellness or family sciences, 4-H youth development. Many of you may be familiar with the 4-H program. And so that is all run through Extension. And so that is an organization I've been involved with ever since I was a child as a 4-H member. And it's been quite an honor to serve as an NDSU Extension professional in my adult career here. And so Went to NDSU, studied animal sciences. I'm a huge livestock person. Like Vicki said, I still farm. My family and I have about 75 head of beef cattle. We're a cow calf operation, and you'll continue to hear the word farm and not ranch. You farm in eastern North Dakota, you ranch in western North Dakota. So just to get that housekeeping out of the way. Just to provide some context and some humor as well. But I'm very, very proud of my agriculture roots. I am an outdoors person. You will never ever see me, inside doing things that my younger sibling loves, like cooking and quilting. I would much rather be outside hauling manure or work on the end of a pitchfork versus being in the house. And so these are just some photos. My family is really important to me. My nieces and nephews. On the upper left photo, that's just a small snapshot of my family. That's not everybody. I have five siblings, and my parents, and so we're a really big family. And as you can see, huge Bison football fans. And I'm also a student. So right now, at that very bottom center photo, that's a picture of me and one of our graduate posters with one of my advisors at the American Public Health Association conference that was in Boston a couple years ago. So that was quite an experience to be in front of that audience. And so the reason I'm just showing you these pictures is I want you to really understand the roots and kind of why I'm passionate about farming and agriculture, because it is me. It is who I am. You'll see my sheep in the background. I've got 40 head of ewes. We actually just started fall lambing last week. And so, on top of my full-time job, farming is my second full-time job. And it really helps me drive home how important farm and ranch safety really is because of loved ones I have had that have been impacted by farm and ranch related injuries and fatalities. Um, so I think it's also important to understand that I am not an island. The work that I do takes a team. And so obviously you'll see in the upper left another photo of my parents. They're my rock. Huge. I wouldn't be able to farm if it wasn't for them. And so they're a huge part of my team and network. In the middle, we have Dr. Cheryl Saar in the teal. She's an MD at the Sanford Trauma Center here in Fargo. Huge role model and person that has really helped me understand, and many of you see the crappy side of production agriculture in terms of the injuries and unfortunately the deaths that you have come through your ERs, that come through your clinics. I mean, you guys get to see the really bad result of I'm just going to say it, the mistakes that can happen on a farm or a ranch. And so Dr. Saar has been really instrumental to help me see that end piece, and she really loves and believes in what we do here in extension to focus on prevention. And so she and her team, Dr. Tyler Sang with the research team at Sanford, have been huge role models for me to really get my foot into research. And so we'll present some of our research work tonight as well, and just some fun pictures of my team at Extension and some of the programs that I'll be talking to you tonight about, and the multi-state collaborations. So you'll see the golden gopher for you Minnesota fans. That's me with my horns up symbol next to the golden gopher. We partner a lot with multi-states, so I have a lot of respect for this entire coalition to band together and focus on issues together as a team. When Chettie brought up this opportunity, I I was just so amazed at the awesome collaboration that all of you have to sit down and butt heads in a room and really work on solving these problems that impact all of our states together. And we do that here at North Dakota State and with our neighbors as well. And so just wanted to paint this picture that I'm very team focused. I can't do this work alone, and I don't want you to walk out of here thinking, holy crap, look at everything she's done. Well, Angie's done it because of the team that stands beside her. And so I wanted to make sure to give credit where credit's due. Don't panic when you see this long list of objectives. We have a lot of materials to cover tonight and a long time frame to do it. But I think it's important. I want to be transparent with what are the things that I hope to cover within our time slot before the next presenter. And if we don't get to it all, that's okay. There'll be no hard feelings on my end. I have some key things that I really want to make sure we talk about tonight, but just going through and I don't know everybody's background on here. And so in the chat, not the Q&A, but in the chat, if you grew up on a farm, I'd love to know, please share in the chat if you have farm experience or grew up on a farm, anything to help me really understand our audience tonight. And if you didn't, that's okay. That's another reason why I was excited to talk about growing up on a farm and youth farm safety, because not everybody has that background or even just the terminology. When Chettie and I were talking, some of the lingo or the language that I use, if you didn't grow up utilizing that or grow up around it, you have no idea what I'm talking about. And so I need to make sure that I'm doing a good job being clear and transparent with you. And so really wanted to go through and talk a little bit about the agriculture lifestyle, so the challenges that our families face when they're raising kids on the farm or the ranch. um, and talking about what are the statistics. I think some of the number one questions I get is, well, Angie, like how many kids have died this year due to farm related incidents? And it's not an easy answer. There is no clear cut crystal answer. And I want to talk to you all about why that is, because that is the surveillance piece is huge and needs to it needs to have some light shed on it. Um, and really focusing on why that surveillance piece is so challenging. I also want to share with you the research that we're doing here. Never in my wildest dreams did I envision myself as a researcher. I still don't to this day, but my advisor, my professors keep trying to tell me, no, Angie, you are now a researcher, so just own it. Um, and so we're doing some pretty cutting edge research in terms of helping with surveillance in the upper Midwest. So this region that you're all a part of, and we'll talk a little bit about that. I want to talk about the youth work guidelines. Okay, so these are really interesting guidelines that I don't think get enough press because nobody knows about them. Our audience of parents and guardians out there just have no idea that these exist. And so I think this is a great audience for all of you to have some awareness of what those guidelines are and how we can help as a team spread awareness to guide families when it comes to working with young kids on the farm. Talk about some laws, so the hazardous occupational order within agriculture. Talk about what we're doing here at North Dakota State when it comes to youth programming in agriculture, and then recommendations, my thoughts on how we as a team move forward. And Chettie also really encouraged talking about, what to expect when you arrive on a farm scene incident where there could be an injury or a fatality. So that's kind of the game plan tonight, if I'm able to keep moving this forward. So when you think of the word agriculture, what comes to your mind? And you don't have to put it in the chat. This is just something I try to be. I want to keep everybody engaged and active, and everyone's at different levels. But when you think of that word, what comes to mind? And so in my mind, these pictures, right? So we've got young families with small kids, and we're integrating them right away with our livestock, right? We're feeding cows, we're giving bottles to baby calves, we're picking eggs from the chickens, we're we're out there playing with the hay bales. And we also picture this really beautiful, picturesque red barn, right? When I asked you that question, hopefully I gave you enough time. When you think of agriculture, you just think of this pristine postcard picture, and the reality is, it's not that simple, right? And we want our families, we want our kids to really embrace in a lifestyle that has this simplistic, wholesome, healthy, homegrown um, mindset or skill set. And the reality is, it's agriculture is complicated when it comes to raising a family. And what I mean by that is, are we looking at agriculture as a job, as a career, as an occupation? Or when we think of the word agriculture, are we thinking of more of a lifestyle? And and hopefully I've got you kind of scratching your head a little bit, because I don't have a full answer. It's really, really complicated, and it becomes a gray area. And I show this picture. So if you haven't noticed, I love teaching with pictures and telling stories with pictures. This is one of our cows. She had triplets. Yes, I'm not kidding you. Triplets. We've never had triplet calves ever on our farm, that my dad can ever recall. And so I put this picture on here because this was a complicated situation for this cow. I mean, she had no idea what was going on. You're supposed to have one calf. Now all of a sudden there's three. They're all mine. This is not what I signed up for, right? So agriculture has really, really complicated meanings and connotations with it. And it's a gray, complicated area, because I want to ask you next, when you're working on a farm and have a family, which hat are you wearing today? Okay. Are you wearing your dad hat, your mom hat, or are you wearing your farmer hat? And what I mean by that is, which job or what hat, which job are you doing today? And my next question is, well, can you wear these two hats at the same time? And I realize I'm making this big, broad, complex thought process into something as simple as hats, but I hope it gets you thinking. Holy smokes! When we're a parent, and I'm gonna be forefront honest, I am not a parent. I don't have children, so I can't attest to this. But being around my siblings that have kids, you know, I would say being a parent is a 24/7 job, right? And so when you're working on the farm, that can change. And I'm not saying it should. That's not my point. My point is, it is really, really hard to make sure that we're always wearing our parent hat before our work hat, before our farming hat. And that's not easy, and we'll talk about that in a little bit. This is where it becomes that gray area that I was alluding to, right? So when parents and guardians try to wear that hat, both of those hats at the same time, what ends up happening? And this is where I've seen situations unfold where this does happen. And I'll give you an example. So um we've got a pretty young teenager, right? Very, very independent. Has tagged along with his dad. They've got cattle. He went out to check the pasture fence. His dad said the fence needed wasn't electric shock in the fence. So typically here in North Dakota in the east side, we use a lot of electric fence. So there's a small energizer that's providing power or shock to that fence. So when the cow touches the wire with her nose, she gets a small shock and knows that she can't extend beyond that fence. And so he took his UTV, his side by side, out to go fix that fence. And they live on a gravel road, but in order to get to the pasture, they have to drive on a state highway. He was making a left turn, and someone in a minivan decided to pass him. That young man is lucky to be alive because he knew better to have his seatbelt on when he was driving that ATV. And what I'm getting at is, should that parent, and I don't want to play the blame game. I'm just trying to get this group to really think about, boy, I think dad had his worker hat on or his farmer hat on before he had his parent hat on in that situation. And again, I don't want you to think I'm placing blame. I'm not. I'm just trying to showcase that these are the situations that happen on farms and ranches because these young people, they want to help in most cases, they want to help dad, mom and dad, grandpa. They want to help so bad on the farm. And so we also as farmers, we need the help, right? We need extra bodies to be able to help. And so I can do this while you're doing this. We're getting it done. The rain is coming. We've got environmental factors. So we've got all these things going on in our head. We need to get the job done, and that gets prioritized before being a parent and slowing down and saying, you know what, we can go fix the fence together. I'll drive, or really, nope, I'll go fix the fence. I don't want you on that state highway. And so really just trying to help paint this picture that families have a really hard time differentiating which hat they should wear when it comes to farming and ranching. And the answer should always be that parent guardian hat, right? In our world, that's the person that needs to be protecting and making that decision. Like this awesome poster says, parent first, farmer second. We've got to protect the most important thing that we'll ever raise, and that's our kids. And so it's really hard to help families get into that mindset because we have all these other pressures within agriculture, this awesome way of life, but also this job we have to do in order to make money and provide for our family. So it's this complex web of, man, we got to get work done. I have kids that could help with that. Are they ready to help with that? It just gets to be really, really messy. And the true objective of a farmer ranch is what, it's to make profit, it's to make money, to provide. And so at the end of the day, we've got to help families know what hat needs to be on that head, and at all times when it comes to having young people live and work and play on that farm. So another fun part of my job is really looking at different research and conducting research studies. And there was a study conducted in North Carolina that interviewed a small group of farm families, and they shared their top four. Um, the family shared their top four views when it comes to youth working on a farm and working with youth farm safety. And I hope you guys get a kick out of some of these responses, because it does not shock me. It does not surprise me that this was some of their feedback. Number one was the nature of small farms makes them safer than industrial agricultural operations. I can tell you right now, just because a farm may be classified as a small farm or a hobby farm does not mean that operation is safer than what we would look at as a larger operation, for example. Small farms, it could be the worst equipment, very old, rundown, unsafe, no guards on power takeoffs. It could be extremely dangerous. So just because it's labeled as a small farm does not mean that they're a safer farm necessarily. Okay. Another one is, well, child safety on the farm. That's just common sense. Well, come on, let's give a 6-year-old a break, right? Is a 6-year-old going to have a common sense to, if their toy falls in the grain auger, to not stick their hand and pull it out? I mean, that's not a fair assumption to give a child, that they assume and know that is something dangerous. I mean, that's frustrating to me that we put that pressure on our kids to assume that they know right from wrong, um, so that was number two. Number three, well, jeepers, we should just avoid all hazardous tasks, and that'll keep our kids safe on the farm. Yeah, in a perfect world, but I think we all have a different definition of what does hazardous mean. That can look so different from each family and each kid. So that statement also annoys me considerably because it's so ambiguous. What is hazardous? What does that mean to each individual? And then, last but certainly not least, some of the feedback provided, well, parents know best compared to regulations about ways to keep their children safe, and that's a tough one. That's a tough. It's. I'm not saying it's right or wrong. I'm just saying it's a tough one because we get into this idea of, you don't tell me how to parent my kids, right? And we'll talk a little bit more when I talk about the ag youth laws that we have at the federal level. But it is a piece of this complex puzzle that does sometimes get in the way of how we treat farm safety for kids when it comes to being and living on a farm. So I just thought those were really good pieces to share with you to try and get you thinking what is the mindset of some of our farm families out there when it comes to farm safety and having their kids grow up and be immersed on the farm. So going back to this idea of agriculture, right? So it's this culture, this way of life, this picturesque red barn with chickens and dairy cows, and it's this way of life that we have. It's not a job, it's a way of life. And there's so many, I'm a farm kid. I always will be. And I wouldn't trade it for the world. I wouldn't trade my experiences for the world. There are so many positive things that we get from living on a farm, growing up on a farm. Teaching responsibility, work ethic, pride of a job well done. There is nothing better than seeing new life being born. That is one of my favorite. I still get goosebumps. We're lambing now, and I just think that miracle of life that I get to experience. And you think about the population of the world that will unfortunately never get to experience something like that. It's pretty honorable and noble to be a part of that piece of life. Um, and I won't lie, that extra hand to help on the farm is huge. You think about dairy farms. Oh man, back in the 60s, 70s, 80s, those dairy families, they had a lot of kids. And I'm telling you, it's because they needed help milking cows. It was all about having the workforce to be able to milk cows and have enough people to take care of it and get the job done. A lot of dairies retired or and obviously for multiple reasons, but a lot of retirements were once the kids all left the home, left the house, graduated and moved on if they didn't stay because the families didn't have enough people to help. So having the extra help, that's part of the lifestyle, right? And the lifelong lessons that farming provide or agriculture provides and successor development, that next generation, there is so much passion and pride, and I'm guilty of it, right? I'm a fourth generation farmer on our operation, and that is pretty amazing to be able to have that land and have that responsibility for the land and the stewardship that goes with it. I have a lot of pride for that, and within agriculture, that's a huge piece of our lifestyle. But the thing to remember is at the end of the day, even though we really want it to be this picturesque lifestyle, it is a job. It is I As much as awesome, good, touchy-feely things that I get from working in agriculture, I also have bills to pay. I also need to survive and eat and have a roof over my head. And so the animals I raise, the crops I raise, they do need to provide a source of income. And so the job requires physical abilities. You have to have the strength and dexterity to be able to operate this equipment, to be able to move livestock. You have to. And same with cognitive ability. You have to be able to make decisions, quick decisions on the fly, to be able have the strength to step in the clutch on the tractor, but also have the cognitive ability to watch the baler behind you, watch while you're driving forward, watch all your hydraulics. I mean, there's so much going on that you have to be pretty quick at the draw to make those decisions when you're working with equipment. The hazardous materials and equipment we work with, the unpredictability, livestock, it's a huge problem when it comes to not knowing how that animal is going to respond, especially when it comes to newborn stock. And inexperience with these young people. It's kind of a two-edged sword, or what came first, the chicken or the egg? How do you get experience if you don't expose them when they're young? But when you expose them when you're young, that's pretty hazardous and can have some life threatening implications with it. So it's kind of that experience piece is really tricky to hit home. And then there's also this this mental psyche, right? So I think all of us, even if you weren't in agriculture, I would imagine all of us at one point in your life have gone through a situation when you were young that you were too scared to tell mom and dad that, you know, I'm too, I don't feel safe doing this, or I'm too scared to do this. I mean, we all have that, we want to impress people. We want to prove ourselves that we can do this without any help. And that type of situation, especially with teenage boys, that happens so much on the farm, that we want to prove to dad that we can drive the tractor. We don't need help. We don't need you to show me how to do it. Um, and so that's what is really tough on our teenagers, is this mental psyche of, what will my dad or what will my parent guardian think of me if I have to ask for help. And so I just wanted to, again, try to help showcase both sides of this complex web of agriculture, of all these good things, but also reminding and remembering that whether we want to label it as a job or not, it is 100% a job and a responsibility that we have, to produce crops, to produce livestock, whatever that individual farmer ranch operations goal is. It is a job, and we need to treat it that way. Probably what you've been waiting for next is, understanding, talking about youth getting hurt and injuries. What is actually going on out there? And so the Marshfield Research Clinic, based out of Wisconsin, they, every few years, they actually put together a really cool fact sheet. And I did put a QR code on your screen, so you're more than welcome. Scan that with your phone. You'll get the full report. Or here is the website as well in order to access this fact sheet. I think it's huge, especially for all of you within this profession, if you're looking for youth agricultural related injury and fatality statistics. This is where you get it. And so just kind of breaking down the population that's at risk, and really highlighting that agriculture had the number one uh, leading list of occupational fatalities across all of our industries for youth age 17 and younger from 2010 to 2020. I mean, that's, a 10 plus year span to have that number one ranking is, it's sad, folks. It breaks my heart because of how passionate we are and how much we believe and depend on agriculture, to say that we are, the number one killer of kids in terms of injuries within an occupation. That's a tough pill to swallow, and hence why I get so passionate about working with kids and helping them become better, understood, and pairing them with their parents and guardians to really coach them on, how do we raise kids safely on the farm and ranch. And so I don't want to belabor all of these stats. You guys are all capable of reading, but I think one that sticks out is, a child dies in an ag-related incident about every 3 days. That's insane. I mean, that's unacceptable in my book, and I would imagine for all of you as well. And so, later on, we're going to be talking, we've got an individual talking about ATVs, huge killer of kids. And there's so much prevention education that can be done to help with that. But we've got to have parents and guardians and those adults within that young person's life really be the advocate and step up and have the courage to say no. And that's so incredibly hard. Um, there's a small blue box in the lower left corner, that was really important that I highlighted to you, and because we're going to talk about surveillance in a little bit. But there is no giant database of childhood ag injuries, and even on the adult farm side, the adult side, there is no giant database that exists. And I'm going to share with you a little bit why that is, and what role we can do as an organization, and what we're doing here at North Dakota State to try and get a better job of, or not job, a better grasp of what is actually going on in the upper Midwest, specifically, North Dakota, South Dakota, and Minnesota, because this is where I said earlier, like, I love North Dakota, but we definitely are lacking in some things, and ag surveillance is one of those. And so I'll kind of break that down a little bit for you as well. This is just going through. I know, there's got to be some quantitative folks that love numbers on this webinar tonight, and so just showcasing to you the costs of these youth related injuries and fatalities, right? Because money is, anytime you hit the pocketbook on someone, that's sometimes when you can get people to sit up and really listen. So understanding, not to mention, this shouldn't just get you to listen in terms of your pocketbook, but we're talking, lives lost here. And so, trying to get families to be serious and understand that, this is a real issue, and your kids are not invincible. It's, the saying goes, well, it'll never happen to me. It'll never happen to me. And that drives me absolutely crazy, because it only takes one time for things to go wrong, in order for that tragic injury or fatality to take place. And I really wanted to highlight not only the cost, but looking at, earlier the slide talked about, kids who worked on a farm and that were getting hurt. This is going through some statistics of kids that were on a farm but not working there that got hurt. So these would be good examples of, kids going over to a friend's house, to a grandparent, aunt, and uncle, going to their farm and being an innocent bystander, and or playing in that farm scene, not actually doing any farm work, but just in that farm scene, in that farm area, and getting hurt, as a bystander. And so visiting a farm, it's a big issue. And this is where I think we've got a lot more education and awareness work ahead of us. Again, I hope you're starting to realize I love asking questions and getting you to think about, not necessarily big concepts, but just pieces that I think we take for granted or don't take the time to really fully grasp. So when we look at the job site within agriculture, within a farm or ranch, um, when we think about agriculture, earlier I said, number one industry that has youth fatalities. um let's think about our other industries. For example, yeah, I just talked about kids, dying or getting hurt on a farm. How many construction workers bring their kids to the job site? I mean, we have a lot of construction going on campus. We have full buildings being tore down. I sure as heck don't see any kids out there with their parent or guardian, as they're driving the backhoe or driving the wrecking ball into the building. Same with all of your professions. How many of you bring your kiddos to the hospital or the clinic, or the with you on the ambulance to a scene? You would never ever do that. There's so many risks involved, right? And And so hopefully, I mean, you could pick any industry and ask this question. So my point is just to get you thinking about that. You know, if we're not doing that with other highly dangerous occupations, why are farm and ranch job sites, why is this industry any different than the others? You know, have you ever really sat down and thought about that? And it's pretty unique because on a farm or a ranch, guess what? Once you step out of that door of the house, your job site is in your backyard. You know, you look at this house, you've got the barn right there, you've got many sheds, you've got silos, you've got the driveway. You are living and breathing in your job site every single day. There is no separation. And so, how do you help families differentiate between, a safe place to play outside and where that workspace is? It is really complicated. When you look in this picture, you'll see the house, and to the left of it, you've got the field right there. I mean, there's not a lot of feet of separation there that's separating the house from the field, and that's a common scene, folks. I mean, that's normal. And this driveway that's coming through, I can't imagine, I'm not picking on this farm. I have no idea. This was just a really good visual to share with you. But when they've got corn silage that's ready to go in those 3 silos next to the barn, it's going to be trucks and wagons and constant large equipment moving in that's right next to the house. So again, just making you kind of have that aha moment that no wonder why these things happen. We work right where we live, we play, we have recreation, it's our own farmyard, our own yard is connected right to our job site. So it's just very, very difficult for families to be able to separate that. And I want to ask, just again, I love pictures, and hopefully this is making sense where I'm getting at. Sometimes I feel like I'm all over the board, but you know, does this stuff look safe to you? This corn chopper on the left, this is actually a picture of my not my machine. I definitely can't afford that. It's a custom unit that we have come in every fall, and these are all saw blades, folks. Every single one of them. This machine comes in and completely obliterates the corn plants and turns them into, I'm not kidding you, confetti shaped sized pieces. And it takes many, many rows of corn at a time. And within seconds, it turns it all into confetti and shoots it out the back end. So these machines are just one example of some of the hazards that we've got on our farms. And if kids are playing around that, and that custom driver comes into the cab and can't see, these tires are huge, guys, huge. If kids are playing hide and go seek and they go stand in the wheel well of that tire, there's no way the operator in that cab is going to see them. And so I just wanted to, I know that may seem like an extreme example, but it is such a real example of some of the hazards that you can find on these job sites, these work sites that are also right next to the house, to the backyard, to the play area. I've got these pictures of these 2 bulls fighting. Man, bulls are extremely dangerous, and a lot of people, it drives me crazy. They'll turn them into pets. They'll take a bucket of feed and go scratch their head and talk to them like pets. When it's breeding season, those bad boys got one thing on their mind, and if you're in their path, they do not care. You are no longer their friend. You are no longer giving, this person giving a scratch on the head. None of that. They have no sense of relationship with you at that point. And so they can turn on a dime. Everybody thinks these big bulls, oh man, they're too big and fat and lazy to be able to turn around and charge me. I tell you what, there's a reason why there's guardrail all around. That guardrail makes up this fence. They will destroy in their path. And there'll be people that send kids out with a bucket of feed to go feed the bulls. And it is extremely not safe. And then this last picture, uh, a picture of a leg within a bin sweep, within a grain, or not a bin sweep, I'm sorry, a grain pit. So the pit at the bottom of a grain bin where all the grain flows into that auger system and then is delivered out into the next set of augers to be loaded onto the truck or the semi. This happens in seconds. I mean, you don't stand a chance if your hand gets caught in that auger. The machine will always win. And so again, I'm just showing, these are just 3 pictures just of some things that I think about are so dangerous. And if we don't have our parent hat on when we've got our young kids or our kids working with us, it could end in a huge tragedy. And it doesn't have to if we do the right education and help families figure out the right balance of, when do I know my kids are ready to take on some tasks on the farm. Okay. And so this is kind of just what I wanted to do, is talk a little bit about the surveillance. And we've talked about agriculture being the most hazardous industry worldwide. But I'm going to tell you, our surveillance methods stink. They just do, because the data that you'll see, for example, I'm going to get ahead of myself because I get so excited, but the data that we do have does not include self-employed farmers and ranchers. So what I would classify or think of as small farm operations, not even just small, because you can have a large operation with only one owner operator, one family, but private individuals, so like myself, right? If I were to get hurt on my farm, there is no, I don't have to report it anywhere. Okay. There is no reporting, there's no mandated federal reporting system. If my dad gets hurt on the farm, so family members, that surveillance data that we do have, it does not include family members. And that data also does not include workers on farms with fewer than 11 employees. And we'll talk a little bit about that, but that is the OSHA regulation. So once you have 11 11 or more employees on your farm, that's when you fall under OSHA regulations and guidelines. So the Occupational Safety and Health Administration, they're the ones that, on the commercial side of things have for good reason, have very strict guidelines and reporting systems that must be followed. But farms with 11 or less employees are exempt from that. So if you have 10 employees, you don't fall under OSHA guidelines, which means you don't have to report injuries, deaths on your farm, which I hope you're thinking, oh my gosh, that's mind-blowingly crazy. And earlier I talked about North Dakota and South Dakota. We are behind and lacking in data to describe these ag injuries, and I'll talk a little bit about that. So earlier, when Chettie and I were visiting, she had said, it'd be awesome to talk a little bit about OSHA. I don't get too involved in OSHA because a lot of it does not pertain to the audience that I work with. However, there are different state plans out there. So some states have stricter regulations, or not stricter, excuse me. Some states have their own OSHA plans in addition to the federal level plans. North Dakota does not. We use the federal system. So I apologize for the other states. I don't know your system, but that's why I put this lovely link on the slide. So you can certainly type that link in to your favorite search engine, and you will be able to pull up the map of the US, click your state, and see if your state has any separate OSHA related state plans versus just the federal guidelines. And I just want to keep in mind this idea of family farm, right? Less than less than 11 employees, you're exempt from OSHA, and that's what this chart showcases. So um, if OSHA is not permitted to do safety inspections, health inspections, handle complaints, right? If it meets that threshold of less than 11 employees, and then it breaks down, what does fall under OSHA's inspection and regulation. So the other thing we'll talk about too is, well, what about youth? What about kids? And there is a specific, the Fair Labor Standards Act does have, we'll talk a little bit deeper into that, but I just wanted to bring it up. Kids on family farms, if they work for their own parent guardian, they are exempt as well. They are exempt from any federal rules or regulations when it comes to safety on that operation. So ag versus turf is a little bit different. So agriculture is exempt, but when it comes to working in the turf industry, so working for a golf course, working for a landscaper, those youth actually legally can't do those jobs, which again blows my mind. We won't let them operate a lawnmower for a golf course, but hell, let's put them in a 400 horsepower tractor and chisel plow, a 600-acre field. So just to help kind of wrap your mind around this idea of where does OSHA fall into play if you were questioning that. So kind of some of the work that I've been doing and really been passionate about. When you look into the literature, let me take a step back. So in my role, I focus 100% on prevention. My job is to really help put together programs that our county-based extension agents within North Dakota can then deliver within their communities. So we have this awesome network. Every single county in North Dakota has an extension agent. It's my job to help develop programs that they can then deliver in their communities, and specifically in the realm of farm and ranch safety. Well, the problem is I don't want to create programs just for the sake of creating programs. I actually want to know what are the needs, what's actually happening, so that way we can actually be impactful and make change, behavior change within communities. And so I've done a lot of research trying to figure out what farm injuries and deaths are happening in North Dakota, and what equipment does it involve, what livestock does it involve, and what's happening. But the problem is, as you can see in this last publication or this last bulletin, North Dakota hasn't really sat down and done any serious farm safety work since the 1980s. And I hate to date myself, but I wasn't even alive yet at that point. And so, as you can imagine, agriculture has really, really changed since that report came out in 1982. And one of the frustrating pieces that I've found is some of the data that does exist out there. When they look and surveil it, they lump everything together. So they dump tractors and machinery related injuries and deaths into one category. And that drives me crazy because that doesn't help me understand what actually is causing the injury. Is it a potato picker? Is it a beet lifter? Is it a combine? Is it a baler? That stuff is important to me. If you just list it as farm machinery, that doesn't help me at all. That literally means everything under the Tuscan sun. So throw a dart, hope you land and hit somewhere, right? And so that's a really big problem that we've run into. The other thing, our current methods to identify AI or agricultural injuries, not to be confused with other AI out there, is right now we rely heavily on media reports, we rely heavily on voluntary surveys, and we rely on the Bureau of Labor Statistics. And I'm going to tell you, they all have really positive, I'm glad we have them, but there's some huge limitations with each of them. So I'm not kidding you when I say a lot of farm injuries, the surveillance method that's probably the most used is media reports, which that simply means someone got severely hurt or was killed in a farm related incident. and it made the news. I'm not kidding. That is how we have some systems out there collecting and surveilling farm injuries. Now, you can imagine not every single farm related incident is making the news, right? The news, their goal is to get people to watch the news. And so if someone slips and falls off of a grain bin and breaks their leg, is that going to be exciting, sexy news to draw an audience to sit and watch the news? Or is someone unfortunately passing away in a grain bin going to make the news versus someone falling and breaking their leg? So what I'm trying to get at is not every single incident makes the news. So we're missing tons and tons of data. I mean, right now it's estimated we're missing at least 30% of all farm and ranch related injuries, injuries specifically, because the media is not reporting them all. And I'm not saying they should be there to report it all. I'm just saying that's one of the challenges you get when you use media as a surveillance method. The other method is voluntary surveys. And so North Dakota and South Dakota actually don't participate in the SOII survey. So it's the surveillance of occupational injuries. Our states don't participate. I don't know why. It is what it is. And so our states don't have data to help support and surveil what's actually going on. And then the Bureau of Labor Statistics, why that is frustrating. I mean, I'm so thankful we have that data, but you guys, that's all based on a commercial level. So if somebody gets hurt at a commercial grain bin facility or grain bin elevator, a grain elevator, that is reported to OSHA because that's a commercial facility, a commercial agriculture facility, and it falls under OSHA guidelines and regulations. However, if I were to fall and get hurt off of a grain bin, the Bureau of Labor Statistics isn't going to collect that because I don't have to fill out the OSHA paperwork. I don't have to report it. I'm not a commercial facility. So there's tons of data that's missing because private industry, private ag is not going to be included in the BLS data. And so in case you guys were interested, I wanted to put these links up there. I know I don't expect you to type a million miles a minute here to get them all in, but these are some links to get you to some of that surveillance. I love using Ag Injury News, the Marshfield Clinic. They're the ones that basically scour the internet for obituaries, for news stories, for social media content, anything that triggers their keyword search. When it comes, they've got a huge database of keyword searches that tries to help pull in any type of media outlet that refers to a death or injury with a farm or a ranch related incident. So that's one. I just wanted to give you the resources to be able to access these. And plus you'll have a copy of the PowerPoint as well to be able to have those resources. So what am I trying to get at, right? And my thought is how can we do better? And so this is where I talked a little bit about Dr. Cheryl Sarr and Dr. Tyler saying, with the Sanford Trauma Center here in Fargo, it just, things happen for a reason. And I think I was at the right place at the right time, starting my graduate school journey. My first class of starting college class in a very long time a few years ago. And I was so nervous. I was crying in the parking lot because I wasn't ready to go back to school, but I got in there and we all have to do those awkward icebreaker things. And so I said who I am and what I do and what I'm passionate about, farm safety. And the next day that professor emails me and says, "Hey, I've got a project and an opportunity for you. Are you interested? Are you in?" And of course, if you know me, I jump in with my heart first because I'm always excited to try something new and to take things on. And that's how that partnership with Sanford really started growing and blossomed. And so what we've been doing is really looking at trauma center data within the Sanford system and identifying agricultural related incidents that have taken place, that have shown up at the trauma center. And so specifically, one of the projects we did was looking at pediatric data, so our kids, and what we were able to do is look at 11 years worth of registry data, trauma data, from our level 1 adult and our level 2 pediatric trauma center here in Fargo. And that's a big deal, folks, because we are, again, I love our state, but we're definitely lacking. We don't have a lot of resources. We are in the middle of nowhere in a lot of instances. And so to be able to have this data, we have a lot of people coming into to seek care from very wide regions, due to that Fargo location. And so I just wanted to kind of paint this picture of we actually got to sit down and look at this data and start to categorize it. And we even got to look at AirMed data, which was phenomenal. The amount of detail in the notes of that data was just, it was awesome in terms of helping us really understand what happened in that ag-related incident and be able to take the time to categorize it. Where does it fall? We didn't gain any additional patients from that data. However, like I said, it was so rich with notes, and really helped us for the patients that required air med, using a helicopter system to get to the trauma center. It was really cool data to be able to have access to. Um, so again, kind of putting my research hat on, we really wanted to look at the incident level of these kids entering the trauma center in regards to ag-related injuries, how severe they were, and what was causing it. What were the injury mechanisms, whether that was livestock related, tractor related. What in the world was going on for these tragic incidents to take place. And then we broke it down, we broke it down into different age brackets regarding the youth work guidelines, which I'll talk about, the injuries that took place. And then, like I said earlier, what actually caused them. And I've shared this with Chettie, but I wanted to make sure, if you guys were interested in this paper, I put the title of it on here so you'll be able to search and have access. And if any of you want access to the PDF, please, I'll have my contact information at the end. You can certainly reach out to me, and I'd be happy to email it to you so you can really digest and synthesize the results a lot better than the kind of the snapshot I'm going to give you. This is really text heavy, but for all of you research gurus out there, I just wanted to make sure that I wanted you to see the legitimacy and the detail of what we did with our study, um, in terms of looking at pediatric, agricultural related injuries, and the registries that we used and how we coded it. I think that was a really fun experience because, not everybody within the team we were working with, has an agriculture background. And so I was deemed as the specialist that would come in and, nope, this is a different type of auger. This is not an auger that's related to, an ice auger is different from a grain auger. So I got to help make those categories and differentiate what I would define as a true agriculture related injury versus, the slang or the other terms. For example, tractor trailer, that's a semi, right? So we didn't include those types of things. Toy tractors, you wouldn't believe how many how many people stepped on a toy tractor and had to go to the ER. So those were excluded. So just kind of painting this picture for you of kind of the steps and methods. um, and the fun part of digesting, the results, right? So of 11 years worth of data, we found 41 pediatric patients had been impacted by an agriculture related injury. And oh, excuse me, the thing to think about, what we really had a tough time publishing publishing our work, because the first journal, the Journal of Agri-Medicine, they pushed back on us and said, "Ugh, 41 patients, that's all you've got. You're so small. And boy, was I red hot when we got that feedback back, because that's not fair. Our region is a small region. But that number, it's a big deal to us. 41 kids these are traumas. These are life threatening injuries that have taken place. Could you imagine if we were to even broaden our scope to look at, non-life threatening? That number is, I've got to imagine it's bigger. But nonetheless, we're moving past it. We know that it's a big deal to our region in the upper Midwest. So just breaking down what we saw in animals, so livestock related, especially specifically horse related injuries, life-threatening injuries were a big issue that we saw in our data set. And then falls, lots of falls from hay lofts. And so, we only went with the notes we have, but a lot of that could possibly be contributed to, playing in the barn or playing in areas that are just not safe on the farm to play. And then of course machinery. And so children under the age of 6 and youth ages 16 to 19 had the highest number of injuries. And then females by far, they had over half of the animal related injuries that took place. And then males accounted for all the vehicle related injuries. And that one for sure doesn't surprise me, because a lot of times our teenagers are starting to get ready to drive, and they're getting more responsibility, and they're also at that age where they're taking on more risk as well. And so that that didn't surprise me in our results. But then looking at ISS scores, um, pediatric AI, so pediatric agricultural injury related patients had higher ISS levels than non-ag injury pediatric injuries. And so 19.5% of those ag injuries resulted in severe or critical ISS scores, compared with 16% of non-AI patients. So these injuries are extremely, extremely severe and very, very they're serious. They were definitely um I don't know how else to put it in words, but they were definitely in a serious amount of hurt and damage from the resulting injury, on due to agriculture. This slide may be really hard to see, so I apologize, but basically it's one of our graphs in the paper that's just showing you the different causes, and that's what's really important to me. So, instead of just labeling it as animal, we really broke it down: horses, bulls, even buffalo, which I questioned at first, because, was this visiting a national park type of injury, or was this actually a bison or a buffalo operation? And yeah, they got hurt on a buffalo farm, these two individuals. And so really being able to break down what was causing some of these injuries. And like I said, falls were a big problem, especially from the barn, and being struck by and falling off of vehicles and being run over by equipment or vehicles. That was also so this is just a nice way to show, what actually was taking place. And again, this is in our paper as well. I'm not going to go crazy into this, but for those of you that love numbers, this is just comparing the agricultural injuries in comparison to the non-agricultural injuries that were present at the trauma center. So just to kind of give you some comparison in terms of one versus the other, right? So those that were impacted by ag injuries versus those who were not. And again, in the paper, I don't want to drown you with this. This is kind of going through that chart again in terms of the, what was the cause, but this is then breaking it down into male, female, age, and then the age youth worker guideline groups, age groups. And I'll talk about them here in a little bit. But again, just for those of you that really love the numbers and want to digest into this deeper. Um, I've got about 15 minutes, so I'm not gonna go crazy into all of the different injuries. These are definitely in the paper, but just showcasing fractures were a huge result of ag-related injuries, followed by head injuries, then abrasions, contusions, lacerations, punctures, and then kids 6 and under really had a lot of, over half of all the fractures, and male patients experience more fractures than female. So just there's so much data that you could look at with this, just kind of helping you paint that picture of what types of injuries are taking place. Earlier I mentioned in our paper we utilize the Ag Youth Worker Guidelines. These are awesome resources that absolutely no one knows about. Hopefully now I've got a whole army of you that are now going to become aware of these guidelines and help spread the great word. But basically they're awesome fact sheets that help families understand and have awareness in terms of if their child is ready to conduct a certain task on the farm. And what it does is it attempts to match the task, that farm task, with the appropriate age. And I caution, I don't like getting to the age game because age is just a number. So just because you're 16 doesn't mean you may have the physicality of what we would deem as a typical 16-year-old. Everybody, it's ages and stages. We all develop differently. And so I don't want you to think that these guidelines are hardcore guidelines. I think it's a great starting point for families to their kids. These are questions parents and guardians can actually ask themselves. Can my youth do this job, and can they do it safely? Can they do these certain tasks before I actually let them loose? So for example, this one is feeding milk to calves, right? So bottle feeding calves. You wouldn't think that poses a risk, but it certainly can. And so this is kind of a snapshot of what a fact sheet looks like, and then I've zoomed it and blowed it up so you could see it a little better. But can my kid do this job? But then what is my responsibility as an adult? What do I need to make sure is in place before I let my child do this task? And what type of supervision is required? What are the hazards, and what should they be? What should they be wearing? What are those PPE, or the personal protective equipment pieces that those young people need to be wearing when they're doing this job? So there's over 50 of these different task fact sheets that really help coach and guide parents and guardians on, what is my kid really ready to do this job? And how do I know? How do I know? Can they do XYZ? Do they have good cognitive, hand-eye coordination? Can they demonstrate this job to me, that they know how to do it and how to do it safely? So these are huge. I hope I hope this is a resource that you would be willing to use. Just Google cultivatesafety.org, and that'll take you to the webpage where you can find these. And I can certainly work on getting a whole page of links to share with Chettie and the team, so you have access to them whenever you want. This is me going back to my comment, age is just a number. I kind of got ahead of myself, so I apologize, but really be thinking about, is that person physically developed enough? I'll never, ever forget one of our farm safety programs we did. And I let it happen. Nobody got hurt. I want to just put that out there, but we let a 12-year-old participate, and typically we don't. And, you know, when we got to the skid steer unit, that was a huge aha moment for all of us, because in these newer skid steers, you sit on the seat, you buckle up, but you also have to weigh enough in order to start and turn on the machine. And this 12-year-old did not. And so that was a really good aha moment lesson that I think we need to help families understand. that if your child is not, I don't want to say big enough, that's not what I mean, but if they're not at that physical level yet where they can't even have enough weight to start the engine of a machine, whether that's a skid steer or a lawnmower, that should be a huge red flag that they cannot do that job. And so just thinking about that safety feature is in place for a reason. So if don't put bricks on the seat or blocks or whatever to add weight. It just means that they should not be doing that job. What are their cognitive abilities? So they might be a strong, strapping 16-year-old, but they may not be able to make good decisions or make quick decisions or act on their feet when they're operating equipment. And so just because they might be physically ready doesn't mean they're cognitively, mentally, emotionally ready. This equipment is expensive. Both of these tractors are little horsepower tractors, but they are easily $50,000 to $70,000 machines. Are we ready? Are they ready to emotionally handle that responsibility of being able to operate that machine? And then are they trained? Has anybody ever taught? Or is it just assumed that, yeah, they've watched me drive this enough, they know how to do it themselves. Just let them go. And that drives me crazy when we assume that, kids know what they're supposed to do. They've watched me enough. That's not fair to assume that kids know what they should be doing. And are they ready to react to something like this? I think that's really critical too, is these aren't toys. These are not toys to be played with. And I hate scaring people into learning. I don't like that. I want people to make good decisions on their own, not based in fear. But I think we do need to be honest and honest with ourselves as parents, as farm operators, as farm workers. Um, this is the reality of our industry, that it is dangerous, and if we don't respect it, this is what can happen. And it happens so fast that you have no time to be able to react. And, are our young people, are our children ready to handle that responsibility? I've got a little bit of time here. I do want to talk about what I promised in terms of the HUA, the Hazardous Occupational Order within agriculture. So this was a law set back in the 1960s that created, or not created, but really outlined 11 different tasks that are just too dangerous, just too hazardous for youth under the age of 16 to conduct. So keep in mind, it was made in the 1960s and it has not been updated ever since. So agriculture, again, like I said earlier, agriculture's changed a lot since that time frame, but nonetheless, this is where we're at. But this is what's interesting about this law, this order, is that this only applies to 14 and 15-year-olds who are going to work on a farm other than their own parents' farm. This is not regulated to those that just work on their own family farm. So what I'm saying by that is you don't have to do any training, go through any program if you're just going to work on your own operation, which I think just drives me crazy, right? Like, why is that class exempt from being able to, or exempt from having to be trained, but another class of workers has to? I don't like that. But again, that goes back to that concept I said earlier that's really tough, is you're not going to tell me how to parent or raise my kids, right? And so that's that mindset. I'm not saying that's the right mindset. I don't want you guys to think that, but I'm just getting at, it's a really hard pushback that we get when it comes to helping families and advocating for farm safety. These are the 11 different tasks. And so operating tractors over 20 horsepower, you can't do that. And I'll talk about, there's always exemptions to a rule, right? I'll talk about that in a little bit. But tractors over 20 horsepower, general machinery, again, so it lists all these different what they classify as general machines on an operation, specialized machinery. So talking a forklift, potato combine, some of those some of those really more intricate, intense things, they're not allowed to operate, and really looking especially on construction related equipment. Livestock, this is interesting. This is one that not a lot of families know about. So if you are under the age of 16 and are going to work on a farm or a ranch, you are not allowed, that youth is not allowed to work with intact males, so bulls, rams, boars, stallions, or females that have recently, newly given birth. And that there's good reason for that, but not a lot of people are aware of that piece of the hazardous occupation order. Woodlots, ladders, blasting agents, so they can't work with dynamite, and hydrous ammonia. So this is just looking at that law, those 11 different hazards. The exemption, though, is that if they attend an extension service sanctioned training or a training from their agriculture education department within their high school, there is an exemption that once they receive that training, they can operate tractors over 20 horsepower and some pieces of equipment, in order to work on another farm other than their own family farm. But what's crazy to me is that once they turn 16, doesn't matter. They don't need that training. It's null and void at that point, which again, another piece that just drives me crazy. Why is 16 this magical number that these kids are going to be ready once they turn 16, and it's kind of tied with their driver's license piece. But nonetheless, I don't agree with it. So what are we doing about it? I don't have a ton of time, but I think it's important to highlight the programs and showcase some of the pride, the deep pride that I have with what we're doing. So this training program for teens, we call it Farm Safety Camp. So it's a 3-day, 2 overnight camp that we offer in 3 locations across our state, that really focus on the holistic side of farm safety, not just tractors in specific, but we do tractor driving, ATV driving, skid steer, and machine operation, along with all of these other pieces that we do. Oops, excuse me, sorry. These are just some pictures. I think that tells the story. So each camp, we can hold 16 kids. So within a year, our goal is certifying 48 kids. They have to pass an exam, and prove to us that they can drive and operate safely. And we have failed. Actually, this year, we did fail a student because we felt as a team they were not physically or cognitively ready to operate that machinery. We did not, if we felt that they would be someone we would not feel safe hiring on our operation, we did not want to send them out into a situation where someone hires them to work on their farm. And so I just wanted to show you, this is just a snippet of all the things these kids get to do, and communication is huge. Sun safety, it's not just all the driving. We cover so many pieces of farm safety to try and keep these kids safe. Kind of getting close to wrapping up here. We've got, when we get kids involved with an agricultural related injury, the data that we found, they're more likely to experience more severe injuries than kids that were injured in a non-farm environment. And young kids are, quite frankly, they're at a higher risk. They just are. And so the other thing we really wanted to emphasize is that these kids, they're injured as bystanders while their family members are working on the farm. So it's really showcasing, we've got kind of a, I don't like the word daycare, but we have a real issue with childcare on our farms because there is no childcare other than that parent or guardian who is also farming. And so that kid ends up getting into the workspace because mom and dad have to do chores. Mom and dad have to harvest crops. And so guess where Timmy's coming? Timmy's going to come with in the combine. They're going to come in with the tractor. They're going to help feed calves. So we have a really big problem of, we just have a lack of daycare services to be able to make sure those kids are in a safe environment, off, not with mom and dad or whomever on the farm, and having that supervision if they are going to be on the farm. And setting up boundaries, kind of gonna go through that. We need to supervise. We need to really make sure that we set safe play areas and focus on prevention-based programs, focusing on the family. We can teach kids till the cows come home, but if mom, dad, parent, guardian don't support what we're teaching, it really, how is it going to get implemented? And so making sure that we're not just targeting kids, but also getting the families involved with those conversations and helping families know which hat to wear and when to wear it, and helping families have the courage to say no when something is just too dangerous. I'm going to skip over this quickly because I want to be able to get ready for our next speaker, but something that drives me crazy that maybe you've seen in your states is it's farm show season, it's farm festival season, it's pumpkin patch season coming up. How many of you have ever seen these corn pits or soybean pits, and then they have kids go play because that's how we get them immersed in agriculture, right? Let's play in a giant pit of corn or soybeans. And that's so dangerous because what's that's doing is it's setting this precedent that it is safe to play in grain. And so if I could have your help as a coalition, we need to do more messaging to those organizations that I know they're trying to do the right thing. Their intent is positive. They want to get kids to touch and see grain, but this isn't the way to do it. It's just not. And how do we set that right message? Oops, sorry, I went the wrong way. Same with giving tractor rides. Oh, that just cringes because that's how we lose kids, is from falls and being run over. Could you imagine? I mean, there have been cases where grandparents who just want to give their kids a fun ride, they hit a bump and they kill their grandchildren. They kill their grandchild. And I ask you, was that ride really worth it? Aren't there other ways we can immerse these kids in agriculture other than putting them in that risky situation? And I love one of the posters from the Marshfield Clinic, and it's hard to swallow. They got a lot of pushback from this when they campaigned with it. It's easier to bury a tradition than it is a child. And that's hard. That's a hard pill for farm families to swallow because we want them to be immersed in agriculture. We want them to understand this lifestyle and look at this sexy big machine that I have, and look what it can do, and yeah, you can control the levers and you can step on the clutch, and pretty soon you hit a bump and there goes that family. There goes that family. I mean, it devastates families because of choices like this. And so if this coalition can really help market and message, and I again, growing up on the farm, I wouldn't have it any other way. I am who I am because of it, but I'm so grateful I had parents that really, they had their parent hat on first. And as I got older, and could show them that I can do these tasks, then the farmer hat would get to come on, but that parent hat was always first. I'm gonna get to the last slide here before I get kicked off. Chettie wanted me to talk a little bit about, I know this is, my brain kind of goes everywhere, so I know this is the next tangent. I apologize, but for those of you that deal with these types of injuries or arrive on these types of scenes, I want to make sure that you're safe first. When you arrive on these scenes, it's the Wild West. I mean, there's so many hazards going on. There's so many wild cards in play. You got to make sure you're safe first. And so if this is a power situation where there's an electrocution or even a grain bin engulfment, before you ever enter that scene, making sure that the power is off and not live. And when I say power, I'm not just talking electricity. I'm talking tractor power, being able to shut the PTO or the power takeoff off, to shut the whole entire tractor down before you even attempt to help rescue or perform aid or whatever it is the task you're going to be doing. Gas lines, livestock. A lot of pediatric injuries, like I showed you, involve livestock, and so making sure that when you enter that corral or whatever the pasture scene may be, are you safe from that animal? Are they locked up? Are they removed? Did they need to be put down? Don't jeopardize your life over a cow or a horse. Let me tell you that right now, because it's not worth it. There will always be more cows and more horses. Dogs, farm dogs are a big asset on a farm, but they can be extremely territorial. If we pull up to a farm, we never ever exit that cab of the vehicle until we roll down the window and say, "Hey, is it safe for me to come out with this dog?" Let that owner. They might laugh at you and say, "Yeah, that thing's a big teddy bear." Like, I don't care. I don't care. I need to know how that dog will behave with a stranger around. So just making sure you're aware of that. Fence, machinery. I know this list is missing so much, but these were some of the key things that I could think about, when you're arriving on scene, on site to some of these tragic situations. You got to protect yourself first, even though I know it's our nature to help other people, but you can't help other people until you make sure you're safe first. So with that, I'm gonna stop. I think I've taken up too much of your time already. I hope you found this valuable and not a waste of your time, or I hope it wasn't a lecture at you. I really want this team atmosphere to not only help. I want to continue to advocate for agriculture, but we also need to be honest and realistic that it is dangerous. And how do we protect all of our workers, which includes kids and adults? And how do we make sure we produce the safest, not only the safest food, but produce that food in a safe manner for our people? And so with that, this is my contact information. The best way to get a hold of me is email, but Chettie can also get you phone number as well. I'm more than happy to visit. With that, I guess I'll turn it over. I'm going to stop sharing my screen, turn it back over to Vicki. And yeah, thank you all so much for your time. I really appreciate it.
Angie, that was so great. Thank you so much. I've seen so many of those hard no things, so many. Yeah, we'd appreciate it if you'd stick around a little bit. We're going to have a short presentation from Dr. Goehner on ATV accidents, and then we'll have a few minutes at the end where we can go through people's questions. Dr. Dylan Goehner is a surgical resident at the University of South Dakota Sanford School of Medicine, and he's here to talk about ATV accidents and safety. I'll turn it over to you now, Dr. Goehner.
All right, thank you for the introduction. I appreciate everyone's time. I hopefully won't take too much of it tonight, but really, thank you to everyone who helped put this symposium together, and all the people who are here listening. It really means a lot to be able to share this with everyone. As stated, I'm Dylan Goehner. I'm a third-year surgery resident. I'm at the University of South Dakota Sanford School of Medicine. I work primarily out of Sanford Medical Center in Sioux Falls. So the team that I'm working with here, especially John Reichman, he's our principal investigator. He's one of the pediatric surgeons there. Really, he noticed in the last maybe 10 years or so an uptick in these ATV accidents that he's been seeing coming through his emergency room as pediatric traumas, and along with the rest of his group. And then I myself have had quite a few in my short time there as well. So we really wanted to take a closer look at these pediatric ATV accidents, and specifically for this project, I wanted to look at head trauma associated with these pediatric patients. As with a typical paper, I'll talk about kind of what the issue is, how we studied this, and some results, and then hopefully we can have some Q&A at the end. So what's the issue? So the United States Consumer Product Safety Commission has been collecting data on ATV accidents in the US for a number of years. Most recently, they pulled data in 2018. And, looking at this data, really these pediatric patients aged 16 years and under constitute a huge portion of ED visits and death in the US every year, and a significant portion as compared to adults as well. A third of ED visits and a fifth of all death related to ATVs. We see more kids die every year on ATVs than in bicycle crashes, which is pretty shocking given the number of kids riding bicycles versus ATVs. It's estimated that every hour in the US, around 4 pediatric patients are seen in an ED for an ATV-related injury. We also know that through this data that kids are likely to be more injured after sustaining an injury from an ATV accident. 7 times more likely to be hospitalized than a general peds trauma population, more likely than an MVC. So again, this suggests that ATV accidents are causing quite serious injuries. So this is really what we're looking at, these ATVs, these saddle style ATVs. They're pretty dangerous vehicles, as most of us know. But it seems like there's a lack of, I wouldn't say lack of caring, but more a lack of understanding of how dangerous these vehicles really can be. They're unstable. They have a high clearance, a locked rear differential, and this makes them a little harder to maneuver. They require active riding, meaning you have to kind of lean into your turns. And then they're typically driven on off-road terrain, which requires more situational awareness. All of these things, if you put a kid on this, as Angie kind of alluded to, these kids are not physically or mentally adept enough to really be handling these types of machinery. And so you put a kid on this, it can lead to devastating results, and oftentimes, and this is maybe anecdotal evidence, we see a lot of these kids are riding vehicles that are improperly sized for them. They're oftentimes riding adult-sized vehicles when they're, 12, 13, 14 years old. And so what did we do here? We have a retrospective observational study. We looked at data from our South Dakota State Trauma Registry. That's the entire state's trauma registry, not just the Sanford Health, the institution that I'm working with. So all of South Dakota hospitals from 2012 to 2021. And we pulled data on patients aged 0 to 14 who presented to one of our trauma centers, which is most of our hospitals in the state, with a code involving an ATV or a UTV accident. Those side-by-side vehicles were included, given the difficulty in kind of parsing out the differences in our data set. We did exclude any duplicates or transfers, from a smaller hospital to a larger hospital, motorcycles, dirt bikes, and then we also excluded a death in the field that maybe never made it to the hospital. We did look at our mortality records for this time frame, and this may have only been one additional child. We gathered data regarding injury severity, injury type, morbidity, mortality, as well as protective equipment use, and then basic demographic data. We used the tests listed here for our data analysis. Briefly, I know probably most of you know what an AIS and an ISS are, but for those that don't, I'll just briefly kind of summarize it for you. An AIS is an abbreviated injury scale here. So it takes any injury that was sustained, it assigns it a body system, and then you grade it from 1 to 6, 6 being a virtually unsurvivable injury, and then 1 being a minor injury, and then anywhere in between. And then the ISS, which is the injury severity score, it's a well-validated score, and it has linear correlations with mortality as well as morbidity and hospital length of stay, and other measures of injury severity. So it's a great scoring system to use, and it just takes your 3 highest injuries as graded by your AIS. It squares them and then adds them together, and you get your ISS, as in the example listed there. Of note, an ISS greater than 15 is considered a major trauma. So on to our results here. In that time frame, we had an N of 225. So we had 225 kids who met our inclusion criteria, presented to a South Dakota Trauma Center with an ATV accident. In fitting with demographics of our state, about 83% of these were Caucasian, and about 70% were male. In looking at, and I'm sorry I didn't include this on this slide, but I did kind of look through our data, and about 24 of them were from our most populous counties. So, Lincoln, Pennington, Minnehaha counties, and the rest of these were all from rural counties. So really a majority of these were, the trauma registry doesn't parse out, whether it was a farm accident, it just versus, on the road or anything like that. It says it would list occupational versus other. But again, just looking at that data, a majority of these injuries occurred in our more rural counties. So our overall data of our 225 kids, the average injury severity score was around 6.5, 7, somewhere in that range. And you can see here that if you look at the maximum ISS, our maximum was 41. We had a number of them in the low 30s, and we actually had quite a few severity scores in the 20s. And so we had quite a few severe injuries within our data set, as well as 6 deaths within our data set. So what we were looking at specifically with ours is head injury. So of our 225 patients who were involved in an ATV accident, 73, so about a third of them, that's 32%, suffered a head injury at the time of their accident. In comparing the head injured versus the non-head injured patients, those that suffered a head injury were more likely to be having higher ISS. And again, that correlates linearly with morbidity, mortality, hospital length of stay, ICU days, those measures. So again, those that suffered a head injury are more injured overall, as well as looking at our maximum ISS was higher in our head injured patients. Here, looking at just those head injured patients, those 73 patients, our average AIS, so that was that abbreviated injury scale from 1 to 6, was about 2 in these all comers. Really no differences between those who were younger versus older. I found this to be probably the most shocking piece of data that we gathered during our research. Of our 225 patients, only 32 of them, so only 14% of these kids were wearing a helmet at the time of their injury. I did a little further digging after I found that, because I felt like that is extremely low, but it actually is fitting with similar studies around the nation in regards to bicycle, motorcycle use in pediatric patients. Any estimates ranged anywhere from about 11% to 65% in other studies. So, but 14% I would say is definitely on the lower end of what I saw. You can see that those that were wearing a helmet had a lower average AIS in their head region. And then I think more importantly to note, our maximum injury in our helmeted group was only a 2. So all of our 3s, all of our 4s that we saw within our data set all occurred in patients who were not wearing a helmet. So, the worst head injury that we saw in a helmeted patient was a moderate head injury, a 2 on that scoring scale. And then finally, just the basic number, our 32 patients who were wearing a helmet, a quarter of them, so 8 of them had a head injury. And then 65 of our 193 unhelmeted patients, I'll do the math for you, it's 33% had a head injury. So a little higher incidence of head injury in those unhelmeted patients. Looking at overall injury severity score, there was really no difference between helmeted and unhelmeted kids. Our average ISS was different, but our median kind of threw off our data here. So there was no statistical significance to this data point. However, I do want to point out that again, the maximum. So our maximum injury severity score in the helmeted group was 13. So again, I said 15 constituted a severe injury. So not even a severe injury in any of the helmeted kids, versus all of our 20s, our low 30s, and that 41 ISS score that we had in our data set were all in the unhelmeted group. And finally, all 6 of our mortalities that we found were unhelmeted at the time of their injury. In talking with the surgical staff, the trauma staff, in there, I think 5 of these 6 occurred at our center, and none of them were wearing helmets, and likely all from head injuries, is what I've been told. So to kind of wrap things up from this study here, head injury it's a problem in these pediatric patients and as involved in ATV accidents. These kids are more significantly injured overall than any kids without a head injury. And we know that helmet use can be useful in preventing mortality and morbidity. And finally, we tend to use this data to help educate providers such as you all, the public, on the dangers of ATV use in the pediatric population, as well as really advocating for proper protective equipment use. Looking at our state legislature, there's no helmet law in South Dakota. There are some states that have them, and they've been proven to decrease head injuries and morbidity. And so I think that's definitely a direction that we want to take this study, is to help reach out to our state legislature. There's some limitation to our study. The data collection wasn't uniform throughout. It's multiple different hospitals, multiple different counties of multiple different levels. And so the data was, missing data points in many cases, but, and as well as, it was not a single institution. It wasn't all Sanford, Avera, Monument. It was all separate institutions. I want to thank our ACS chapter for kind of sponsoring me to put together this topic. Our state trauma system for helping with the data collection. It was huge. Our study team, Tyler up in North Dakota, she did all the statistics, Tyler Sang, and the rest of the team was really, really helpful in kind of gathering this data and getting this project off the ground. So I want to thank again everybody for your time. Take home points, ATVs are dangerous, and definitely encourage anyone that you talk to, anyone on the farm, anyone that you know of that's riding these or letting their kids ride them, make sure they're wearing their helmets, try to get ATVs that are properly sized. And again, education. It's all about talking. That's why I'm talking here today, is I'm trying to spread the word on how dangerous these vehicles can be, and hope create a trickle down effect, and then you guys can all kind of tell people about how dangerous these vehicles can be. So I'll share my email address in the chat. If anybody has any questions, you can email me, or again, here we'll have this quick Q&A at the end of the session. So thanks again for your time. I'll hand it back over.
Wow, what an impactful study. That's really great. Thanks so much for being with us, Dr. Goehner. We do have just a couple of questions, and then we'll wrap up here. One question is kind of a two-part question. Do you see a lot of Angie skid loader type accidents with children? Is that something that's fairly common? There was a pretty bad skid loader accident with a couple of kids in Iowa.
Sure. So in our pediatric data, no, that wasn't something, but you got to remember again, that was a very limited, that was our trauma system here. That doesn't mean, from a region-wide perspective with all of our states, that I'm not sure, but I know from our data, that hasn't been something that we've seen in the trauma registry. Doesn't mean there's not injuries that aren't happening, but also to remember, like the previous individual talked about, those that had unfortunately died before, coming to the trauma center, those incidents are not included in our data set. And so if there was a skid loader incident, and that individual passed away before being rushed to the trauma center, that's not included. So it doesn't mean they're not happening. It's we just don't have, I don't have or have seen strong data, but we are training our kids. So at our farm safety camp, I don't know if you saw that Bobcat skid loader picture, but we are training because more and more farms are using skid loaders. You know, it's not just a tool for construction workers anymore. It's definitely, I have one. It's definitely a
Mhm.
farm tool. So we're trying to do way more training on skid loaders because quite frankly there isn't. So we've partnered with Bobcat to offer more skid steer training.
Mhm. Another question, do you often see multiple victims in these accidents, either from, you know, two kids getting into trouble on an ATV, on you know, a tractor, whatever, and also, you know, the second victim as a potential rescuer, you know, trying to save the first one, like in hazmat and that kind of thing?
Sure. No, that's a fantastic question. I would say our data hasn't on the pediatric side, we haven't seen a lot of that. On the adult side, that's a different story. You know, someone becomes a second victim because they were trying to rescue someone else. So that's fairly common. Our we did not include ATVs, UTVs, just like the previous individual said. It was really hard for us to differentiate between, was this on a farm doing a farm task or was this recreation? So we just, ATVs need to be their own thing. That's why I really appreciate um the MD that presented that work because they are their own beast. And so I'm saying that because that's typically where you see multiple victims because kids want to ride with two kids. They want to ride with two people. And so once that machine rolls, typically it's the secondary rider that receives the brunt of those injuries. Just from some of the experiences and data that I've seen. I don't know if Dr. Goehner has additional feedback on that, but in terms of the two victim thing for the pediatric side, not as much as the adult side.
Mhm. One last question, kind of for both of you. A lot of our audience is emergency care providers, obviously, EMS providers and folks who work in the ED. Aside from treating injuries after they happen, what would you suggest is a manageable thing that each of us can do to try and help make an impact on the numbers of kids who are injured in farm accidents?
Whoa,
I know, right?
very, very deep for 8:30 at night. That's it's hard because I guess just my perspective, so take it for what it's worth. It's a very tough subject because we don't want to get in a situation where we're placing blame, right? That scares me a lot is I don't want some parent thinking, "Oh my gosh, this is all your fault. You put your child in this situation." And, you know, that's not the story. The story should be, especially hopefully if that individual survives, how do we prevent this from happening again? And really it's that wake up call of wow, I need to think about this differently um and make sure that we don't put ourselves in that situation. I know I don't think that fully answers your question, but I think that's because I don't have a great answer as to, how do we make sure we don't play the blame game on the victim or their family, but really if we've survived, how do we learn from this? And unfortunately, in those cases where those individuals don't make it, how do we advocate and be a voice to make sure that this doesn't happen to other families and make sure we do more education?
I think with regard to injury prevention too, would you say that reaching out to your local extension service and, you know, from materials, a lot of our emergency folks have access to schools, and do presentations in schools and do outreach and have open houses and that kind of thing. Are those
Absolutely.
good avenues to get that
They're
information out?
huge. Every state can do a progressive ag safety day. So I bet I would imagine a lot of you may be even asked or involved in those activities. So you bring the elementary school out to the fairgrounds and you have different stations, some type of safety event like that. Absolutely. Those are huge pieces and to get kids exposed because as we talked about, it's not necessarily just the kids working on the farm getting hurt. It's those kids that are visiting. They're visiting grandma and grandpa. They're visiting their friend's farm and they're playing and that's when they get hurt. So those are really hard things to teach as a parent because you don't live that lifestyle. If you're just going there to drop the kiddo off to visit or whatever, how would you know what those hazards are unless you really grew up with that and are I don't want to just say aware, but be strict, be stern. Like, don't play here. And you know what? If grandpa wants to give you a tractor ride, how do we have that conversation? That's hard. That's a hard one. Because grandma and grandpas, they want to give their kiddos everything and spoil them. But how, as a parent, how do we make sure we set boundaries and know that that's not okay to do with my child? That's hard. That's a really hard conversation.
Dr. Goehner, how about on the ATV side? Are there, helmet clinics for ATV helmets? They have them for bike helmets, but what types of prevention activities could our folks get involved in?
Yeah, certainly, there's different things, different educational, seminars that you can hold at schools and local events at, if you go and talk to, a big school auditorium, you can really just educate on proper helmet use, what types of helmets you should be using. There's materials out there on the internet that, show kind of what the safest type of helmet is for certain types of vehicles and certain bicycles and those sorts of things. So, again, yeah, I think I said it in the chat, but prevention is key, and we need to just do our best to help educate everyone. People are going to make their own choices, but it's all about educate, and hopefully we can kind of change the culture, shift a little bit more towards safety. So.
I think to add to that, partnering, partner in North Dakota. I'm sorry, I can't speak to other states, but I partner with North Dakota Parks and Rec. They provide our ATV certification program for kids and adults. They do adult training too. Fun fact. So whatever, Minnesota DNR, whatever your acronym is for your, outdoor Parks and Rec, DNR, Department of Natural Resources, those typically are the organizations that offer, certification classes or safety classes, and provide helmets. In North Dakota, if you take an ATV class as a youth, they provide you a free helmet. You go home with a brand new ATV helmet. And so I can't think of a better way to get helmets in the hands of kids. They're expensive. They're expensive investments for a reason. You only get one brain. And so being able to advocate with and work with those types of groups, I think would be a great partnership opportunity for our organizations out across our states.
Thanks so much to both of you. We are out of time. We very much appreciate your willingness to share your time and your expertise very much. Let me just remind our audience of a